Hey guys, hey. I'm here. How are you? It's Sunday. Can you believe it? It's Sunday. The weekend was pretty amazing. How are you guys? Let me know if you can see and hear. I did not realize yesterday that I thought that my speakers or that my mic I was using the mic from my laptop. And then I found out that it was using the mic that was attached to this. And so it was very blah, 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 blah. Anyway, hey, Mary Lou and Billy. Hey, Henny and Sherry. How are you guys? How are you? Please let me know that you can see and hear before we get started. Ah, my goodness gracious. So, good. Yes, see and hear. Okay, good deal. Good deal. Okay, so we are going to start straight where we left off yesterday with this trial and get caught up. We're going to get caught up. So I'm very excited about that. And I'm sorry if you guys can hear the background noise. Kids, it's Sunday. It is what it is, right? But yes. I'm ready to get this going. And then when we get through the trial part, I want to go over the Savanah Soto and Matthew Guerra case, and also talk a little bit about Gypsy Rose for you guys, because I know you guys are itching to talk about little Miss Gypsy Rose. She's just everywhere, right? She's everywhere. And I kind of am like, I have mixed feelings about it, but also I'm kind of happy for her at the same time. I don't know. It's a very fine line how I feel about Gypsy Rose. I don't know. I just don't know yet how I feel about it. But anyway, we are going to get straight into this case and see what happens. So we ended with that medical examiner yesterday that did the autopsy, and we're starting with another witness right after that one. So let me just share the screen here and we will get moving. Share the screen. Okay. Gonna share that. And try to get things situated here. All right. Here we go, you guys. Here we go.
Raise your right hand. Yes. You solemnly swear affirm the testimony you give to the court should be the truth and nothing but the truth, so help you God.
Yes, I do.
May you lower your hand, state your name and spell it for the record.
George F. Jackson, Jackson.
Good afternoon, Dr. Jackson.
Good afternoon.
Dr. Jackson, where are you currently employed?
I am currently employed with the New Jersey's Office of the Chief State Medical Examiner. I serve as the Executive Director of Laboratories and Chief Toxicologist for the state of New Jersey.
And how long have you served as the chief toxicologist at the?
From December 2019.
And have you memorialized your resume and your CV? All the places you worked, have you written that down into your CV?
Yes, I have. I'm sorry.
Yeah, may I approach?
Yeah.
He seemed really confused for a minute there.
Component was marked as States Exhibit 79 for identification purposes. Dr. Jackson, what
Thank
is
you.
depicted in States Exhibit 79?
It is a copy of my CV.
Is that a fair and accurate copy of your CV as you recall?
Yes, it is.
You're at the time of state with Exhibit 79.
Any objection?
Objection.
All right, 79 is admitted.
And prior to working at the New Jersey State Toxicology Lab, where did you work prior to that?
Oh, I work for the Armed Forces Medical Examiner System in Dover, Delaware, the military medical examiner system as a forensic toxicologist.
At some point, did you ever open up your own business in the field of toxicology?
Yes.
And how long did you do that?
For about 8 years.
What kind of, did you ever serve in the military?
Yes.
All right, and what branch of service did you serve?
I was
What branch of service?
branch Air Force,
Thank you for your service. How long did you serve with the Air Force?
3 years.
All right, so can you tell me what is a toxicologist?
A toxicologist is an individual who studies the field of toxicology. Toxicology is the study of the adverse effects of drugs and other compounds on living organisms. Forensic toxicology is the application of the field of toxicology to medical legal situations such as the one before you today.
And did you go through any education, or what kind of education did you receive in order to work as a forensic toxicologist?
I have a bachelor's science degree from Morgan State University, a master's degree from the Medical College of Virginia in pathology, a PhD from the Medical College of Virginia in pathology, specialty toxicology. In addition to that, I am a fellow of the American Board of Forensic Toxicology. I'm a fellow of the American Academy of Forensic Science. I also have certification as a master for clinical chemist, as a toxicological chemist. I have a New York license as a director of laboratories, a license from the New Jersey Medical Examiner Board as a bioanalytical director.
And have you ever published any literature in the field of toxicology, forensic toxicology?
Yes, I have. I've published in the field of toxicology, peer-reviewed journals. I've given lectures and made presentations at many different events.
Have you ever testified as an expert before?
Yes, I have. I've testified in the local, state, federal, military, equally for the prosecutor as well as the defense.
Approximately how many times have you testified in court as an expert?
Never been asked that, but numerous times over 25 years.
And have you ever been qualified as an expert here in Georgia?
Yes.
And when you testified in court as an expert, was it in the field of forensic toxicology?
Yes, it was.
Your Honor, at this time, the state would tender Dr. George Jackson as a forensic toxicologist.
Any objection?
Objection.
You will testify as an expert in forensic toxicology.
Dr. Jackson, at some time you were employed at the National Medical Services. Can you tell us about your time there and the role that you played?
Yes, that was in the late 90s, I believe. And I did a 1 year, I was supposed to do a 1 year fellowship at National Medical Service for about 3 years. Ended up staying there. And my position was as a forensic toxicologist, which we handle cases from many different types of cases from all over the country.
And how long were you employed at the National Medical Services?
Approximately 7 years.
And while you were at the National Medical Services, did you serve as a forensic toxicologist?
Yes, I did.
Is National Medical Services a private lab or a state lab?
No, it is a private lab, one of the few private labs in the country. They provide services in the area of clinical, forensic toxicology, and criminalistics.
And where are they located?
They're located in Willow Grove, Pennsylvania.
And at some point during your time there, you received specimens in reference to a case in DeKalb County. Do you recall when you received that? If you don't recall, it's a capital refresher recollection.
Could you refresh my memory?
Sure.
Young man, approach.
Yes.
Dr. Jackson, do you
Hi, Lee.
reduce your findings to a medical
Hey,
to a
hey,
report?
hey.
Yes, I do.
I'm going to show you what's been marked as State's Exhibit 75 for identification purposes. What is contained in State's Exhibit 75?
This is a
How are
copy
you
of a
this,
report from National Medical
afternoon,
Service authored by
Lee? How are
myself
you?
to the Office of the Medical Examiner in this county.
And is this county DeKalb County?
Yes.
Is that a fair and accurate copy of the report you generated back on March 22nd, 1999?
Yes, it is.
Your Honor, at this time, oh, sorry, Tender. I'll let you. All right, so you received specimens from the DeKalb County Medical Examiner's Office.
That is correct.
Can you tell the jury what kind of specimens you received?
We received at National Medical Service 2 white plastic containers containing skeletal muscle.
And how do you know that's what you received for this case?
When specimens are received at National Medical Service, they go to a very secure area called our specimen receiving area. There, the specimen is observed, looked at, and assigned a unique accessioning number that follows the case throughout the whole testing. That number was 313364. In addition, the medical examiner of this county has an identification code, which is also listed on the report. The specimen never leaves that area. We perform all action within that secure area.
So you received, what did you receive in reference to this case?
2 plastic containers containing skeletal muscle.
And what was requested, what type of tests were requested by the Office of the Medical Examiner in DeKalb County?
They requested a toxicology analysis of the submitted specimen, which means we would look for any or all drugs, including illicit drugs or therapeutic drugs.
And can you explain to the jury how you analyze these samples?
We take, first, everything is done under chain of custody, so everything has to be
Use the mic.
tracked.
I'm going to use the mic.
Oh, I'm
You're
sorry.
not talking into the microphone, so it makes it hard for the court reporter to hear you.
Yes, ma'am.
Thank you.
First thing that we do is we have to prepare the
You took a
tissue
little bit of
for
offense to
analysis.
that. It's like,
No, we cannot take solid tissue and use that for some of our techniques. So we prepare a slurry, which we call homogenin. We then analyze it by an instrument called gas chromatography mass spectrometry, or GC mass spec. What that does is we will identify any compound by its molecular makeup. So the testing was done that way, and as a result of the testing, we were able to identify, confirm, and quantitate substances in the submitted skeletal specimen.
Can you tell the jury what substances were found within the skeletal muscle samples that you received?
Yes, we found acetaminophen, Tylenol. We found diphenhydramine or Benadryl. And we also found the metabolite of diphenhydramine, the breakdown product of diphenhydramine.
And so, is Tylenol and Benadryl, are they commonly over-the-counter cold medicine? I mean, medicines that are generally found over the counter?
Correct.
And in reference to your studies, how can you tell the jury the amount of acetaminophen that was found within the sample?
In the submitted specimen, we found 93 micrograms per gram of acetaminophen or Tylenol. We found approximately 2,000 nanograms per gram of diphenhydramine in the skeletal muscle. And we also found the breakdown product of diphenhydramine in the skeletal muscle.
And was there any other elicited or therapeutic drugs that was found in your sample aside from the ones you've already mentioned?
No, there were no others. That was all that was found.
And in reference to are you able to tell the jury, based off the information you found within the samples, when these items were administered into the body?
I can say that the individual was recently exposed to those compounds that I mentioned.
And when you say recently, was it before death or post-mortem?
Oh, it was definitely before death.
Based off the amount of drugs found within the body, are you able to determine, based off your experience, any conclusion as to whether or not this was a lethal dose, overdose, underdose, or any type of frequency in which the skeletal muscle was ingesting these drugs?
Based on the findings and the type of specimen that was submitted, all I can say is the individual was exposed to those compounds. I cannot calculate because the skeletal muscle was decomposed, so I cannot calculate dose, frequency, or whether or not this was acute or chronic exposure.
The two skeletal muscle samples that you tested, were those the only items you received as it related to this case?
Yes, ma'am.
If there was any other types of evidence that you were able to test, would you have tested those items to see if you were able to determine levels of toxicity, overdose, or things of that nature?
For us in the forensic field, yes. If there was other specimens, they would have been attested along with the skeletal muscle.
I want to speak with you about acetaminophen. We've already discussed that this is a over-the-drug counter. If individuals receive the recommended dosage prescribed, would that be considered a safe dosage to ingest in the body if it's based off the prescribed recommended amount?
She said over the drug counter. I was like, that didn't sound right. And then I was like, oh, she meant over the counter drug. I was confused for a second there.
Notated by the actual drug itself or the manufacturer of the drug.
Could you repeat that, please?
Sure. If an individual takes the prescribed dose marked by the manufacturer, would that be considered safe?
Yes.
Are there times if they are not administered or administered incorrectly, is it possible to create a level of toxicity of the drug?
Certainly, if it was not administered correctly, the individual may have side effects to the exposure of that drug.
And can you tell us some of those side effects that the person may have if they are exposed to toxic amounts of acetaminophen?
There's several. There's a GI effect or gastrointestinal effect, nausea, vomiting, disorientation. As you progress, there will be liver problems, maybe liver failure, as well as kidney or renal failure.
If a person is exposed to a level of toxicity as it relates to acetaminophen, are they able to get can medical attention to those injuries within the body be, I guess, can they be fixed in a sense, or can they be cured? And
If I understand your question correctly, these are situations that a clinician or doctor can provide treatment for.
and if no one provides treatment for these symptoms, can death be a result of failing to seek medical attention?
Yes, and I'll explain it this way. We have a saying, dose determines the poison. Everything is poisonous. And it depends on the dose that's given. And without treatment, it is distinctly possible you could go to stupor, coma, and yes, death.
I want to talk to you about diphenhydramine. If administered incorrectly, can it also be toxic?
Yes, you can, if not given correctly, individual may exhibit side effects.
And what are some of those side effects that may be exhibited?
And they're similar to acetaminophen. You have GI dysfunction, and you will have a CNS effect, a central nervous system effect. It can cause sedation. It can interfere with cardiac problems, respiration, and as in the previous statement, based on the dose, it can lead to stupor, coma, and unfortunately death.
If you're overexposed or you overdose or have a significant amount of diphenhydramine, can you get medical attention?
Well, certainly, as with acetaminophen, presentation to a clinician, they would be able to correct the problem or provide treatment.
Earlier, you stated that if you had more information, you would consider that information in any of your testing.
Certainly, yes.
So if you had blood, if you had urine, if you had other tissues, those are things you would test to determine any type of illicit or therapeutic drugs in the body.
That is correct, yes.
If you were also presented with symptoms that a person may have exhibited, will you take those into consideration as well?
Yes, in our field, and I'm speaking about forensic toxicology, not only history is very, very important. So we read the history, we listen to the symptoms or signs that the individual is displaying, and then we provide analysis. Either the analysis will support the history or it will not.
If it was reported that prior to death, the individual whose sample that you tested was lethargic, weak, tired, gagging, didn't want to talk, didn't want to get up, didn't want to do anything, and that the parent of this child knew that something was wrong, what would those symptoms that I just explained to you be signs of?
It could be a sign of many different things. However, given that history and being in the field that I'm in, I'm looking at what types of drugs would cause those signs and symptoms.
And if you were to receive those symptoms and you've tested these samples and know that what contained within the body is acetaminophen and diphenhydramine, using your expertise, what can you say, given those symptoms, whether or not there could have been a level of toxicity between acetaminophen, diphenhydramine, and or both?
If I understand your question correctly, I would take, based on our findings, and those findings are absolute, we've identified those compounds. Based on the history, I would say that this individual was exposed shortly before death to those compounds. Unfortunately, given the nature of the specimen, I can't go beyond that. So could it be an overdose? Could be.
My question, Dr. Jackson, is these symptoms, are they signs of, potential signs of levels of toxicity?
Yes.
Okay. And is it potential signs of level of toxicity with diphenhydramine, acetaminophen, and or both?
Both.
I want to speak with you briefly about the diphenhydramine metabolite. The parent drug is diphenhydramine, correct?
That is correct.
And can you explain to the jury, I guess, if I'm saying this right, I'm trying to
Sorry, I'm messing
it in
around back
layman
here trying to
terms.
put this
But how do we get from
logo
the
up here at the
parent
top.
drug
That's what I
diphenhydramine
meant
to
to do.
the
I didn't mean to cover the
diphenhydramine
screen up.
metabolite?
Sorry about that.
Certainly. When you're exposed to, when you take any medicine or anything, there's 4 processes that your body goes through. You absorb it into your body, it gets distributed throughout your entire body, and then there's a process called metabolism, where the body will break down that drug to something that it can excrete. In this particular case, the diphenhydramine or Benadryl at that stage was broken down into what we call a metabolite, another compound that would be excreted in the elimination phase.
And does it take time, Dr. Jackson, to go from the parent company, the parent drug, to the compound?
Yes.
And in these samples, you had the parent company still active or still present,
Yes.
and then you also had a metabolite that was present.
That's correct.
Is it fair to say that there had to be diphenhydramine within the skeletal muscle that was broken down into the metabolite?
That's correct.
And then there were also diphenhydramine still present as the compound drug.
Yes.
Thanks, Doctor.
Cross?
Afternoon, Dr. Jackson.
Good afternoon, sir.
Just a few questions.
Okay.
The metabolite of diphenhydramine that was found, there is no way for you to say if the parent drug of diphenhydramine and the metabolite were from the same dosage of Benadryl given or multiple dosages, correct?
That is correct, sir. Given the nature of the specimen, it's decomposed. I cannot determine dose. I cannot determine frequency of administration. I can say they were present.
Okay. Because let's say I take diphenhydramine right now, I take Benadryl. How soon would it show up in my skeletal muscle if you were to take a sample of my skeletal muscle?
You wouldn't let me take a sample yourself. I can't give you exact time.
That's okay. There's a ballpark here. What are we talking? An hour, 2 hours?
Maybe an hour
Okay.
or less.
All right. Now, that's going to remain in my skeletal muscle for a while, right? That's going to remain in my skeletal muscle for a while as it processes, correct?
That's correct, sir.
At the same time, my liver is now starting to metabolize this drug that's floating around my body, right?
Correct.
As it makes its way to my liver metabolizes it, and we are left with a metabolite, correct?
That's correct, sir.
Now, at the same time, while that metabolite is now present in my body, potentially in my muscle, that parent drug, diphenhydramine, is still likely sticking around for a little while, right?
Well, the absorption, distribution, metabolism, elimination is a cycle, and that's a constant cycle. So yes, the diphenhydramine is going to be there.
While the metabolite is there, potentially.
Yes.
Okay. So the fact that there is a diphenhydramine concentration given and a metabolite given doesn't tell you anything about the amounts of dosage.
No, given the nature of the specimen, and this is a post-mortem, I cannot, without additional information or additional tissue, I cannot determine dose.
Now you went through this a little bit on direct. I just want to be very clear. The findings you found were the 93 micrograms per gram of acetaminophen, correct? Is that
Correct,
right?
sir.
Okay. And approximately 2,000 nanograms per gram of diphenhydramine, right?
Correct.
Because of the sample and because of limitations of science, you will say that it is possible that that represents an overdose, right?
Actually, all I can say, they were exposed. Whether or not it's an overdose or therapeutic, I cannot say.
Okay. But it's it could be an overdose, it could be therapeutic, it could be a trace dose, correct?
Correct.
And a trace dose is one that the child who ingested the drugs would have no even of the positive effects of the drug, correct?
Well, yes, sir. In this particular case, there's very limited information that I can give you, unless you're giving me hypotheticals, other than that this is what we found in a skeletal muscle. I would, to answer all of your questions with a absolute answer, it's going to require a lot more information than what I have here, sir.
And that's information that we don't have in this case, right?
That I don't have, but it has not been presented to me, sir.
And what we are left with is this child was exposed to some amount of Tylenol and Benadryl once or more.
Right.
Thank you.
I can't determine that, sir.
Thanks.
Any redirect?
No, Your Honor.
Thank you. Any
So I know that was Lee. I know you're thinking, here we go again, and I get it. But that seemed to be a little bit less painful than it was yesterday, right? Am I right? A little bit less painful. Okay.
Yes, Judge.
Thank you so much. Call your next witness.
The state calls Dr. Gonzalez.
Now this is the one that's going to be interesting, because this is the guy that they're going to have to keep like hushing, because he's going to want to get his point across that he can quantify the things, right? So we'll see how this goes. This could be fairly short and quick and to the point, or it could get ugly real quick. I don't know yet.
Raise your right hand. You solemnly swear or affirm the testimony you give to the court should be the truth and nothing but the truth, so help you God.
Yes, sir.
May you lower your hands, take your name and spell it for the record.
Sure, my name is Mark, M-A-R-C, Gonzalez, G-O-N-Z-A-L-E-Z.
Good afternoon, Dr. Gonzalez.
Good afternoon.
Were you asked to evaluate this case for evidence of overdose?
Yes.
And could you tell the jury about your background that allows you to give these sorts of opinions?
Yes. Well, I started off with a doctor of pharmacy in 1980, and I did clinical work. I worked in a level 1 trauma centers in Los Angeles, and I assessed patients, up to say 60 patients a day, where I evaluated their drug therapy to prevent any types of adverse reactions, interactions, drug lab interactions, and also to evaluate each particular drug for the efficacy or the best treatment available for that particular drug. And so from there, I ended up working, or actually teaching, at the University of Southern California healthcare sciences campus, and I was a clinical instructor.
Okay, so because we saw a lot of this yesterday, I'm going to skip past until he gets to the part where he's talking about like the questions, right? So let me do that real quick.
But in my law enforcement work, I also looked at impaired physicians, impaired healthcare.
And Dr. Gonzalez, specific to the metabolite, are you able to say whether to...
Okay, let me back it up a bit.
And what were the drugs
show up in the toxicology? So you go back, check to see if there's samples available to be tested, and you ask the coroners to test those particular drugs to see if you possibly may have missed something. You do the witness interviews are instrumental. There's so many facets of an investigation, and it's the totality of these facets of the investigation that we look at.
And in this specific case, did you evaluate the entire case file that was provided to you by the district attorney's office?
Yes.
And were you able to review the toxicology report?
Yes.
And in the toxicology report, would it be significant or important to your evaluation as to the presence of drugs found in that report?
Yes.
I'm going to give you a copy for your reference. I'm handing you Exhibit 75 that's already been tendered. And what were the drugs that were identified in the toxicology screening?
Acetaminophen, diphenhydramine, and a diphenhydramine metabolite.
Acetaminophen, what is that commonly known as?
Tylenol.
And diphenhydramine, what is that commonly known as?
Benadryl.
Was the diphenhydramine metabolite significant to you?
The diphenhydramine, yes.
And why was that significant?
It was significant because the level of
And here we go. Here we go. Here we go again. Da 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 da. Right. And here I go. Sorry. I'm just trying to interject a little
Dr. Gonzalez, specific
entertainment
to
there
the metabolite,
in the midst.
are you able to say whether that drug was taken shortly before death?
Yes. I mean, I can tell when it was taken. I mean, I can tell based on the metabolite that, and the level of the diphenhydramine.
No, just answer her question,
Okay.
okay? If
Okay.
she wants more information, she'll
Okay.
ask another question.
Yes, Your Honor.
So is the metabolite significant because it allows you to say that the drug was taken shortly before death?
Yes.
And explain to the jury why that is. Why does the presence of a metabolite mean that it was administered shortly before death?
The victim in this particular case had diphenhydramine in their system while they were alive, and it had time to go through the liver.
Now, diphenhydramine and Benadryl, are they often sold in the same medicine, in the same product?
They can be as a sleep aid.
And would that be consistent with Tylenol PM?
That is correct.
Many nighttime over-the-counter cold medicines?
Sominex,
And do these cold medicines induce drowsiness?
yes.
Now, can acetaminophen, if administered incorrectly, be toxic?
Yes.
What are the symptoms or side effects of a toxic amount of acetaminophen?
The person would be listless, tired, sick, kind of like a flu type sickness, abdominal pain, upper quadrant pain. They would eventually develop some toxins in the blood that would affect their mentation, because the toxins would affect their brain, because they're building up, because the liver is starting to fail.
And if the subject was able to get medical treatment, could those symptoms be treated? Could the person be cured?
Absolutely.
If left untreated, could death result?
Yes.
Would that be a quick death?
No.
Would that be a painful death?
Very slow and painful.
What about diphenhydramine? If diphenhydramine is administered incorrectly, can that be toxic?
Yes.
And what can happen if a person's exposed to a toxic amount of diphenhydramine?
You would see, again, drowsiness. It's a central nervous system depressant. Antihistamines are, the original antihistamines are sedative, and they, with the central nervous system depression, they can cause respiratory depression, shortness of breath. They can actually go into an anticholinergic delirium. Eventually death could ensue from the respiratory depression of the central nervous system depression.
Can a toxic exposure to diphenhydramine be treated if you seek medical attention?
Usually with anticholinergic overdoses, we would use, and in the emergency rooms, we would use supportive care. So in other words, we would have to put them on a respirator. We would give them, they could give them an antidote called physostigmine, which would reverse some of the anticholinergic effects. However, we have to be very careful with those. So it's mainly palliative and basically keeping them alive until the drugs can clear, or the physostigmine can reverse some of the anticholinergic effects. But again, we have to be very careful using those particular drugs, as you can reverse the process completely and have some adverse effects. And that's where, again, clinical dosing is so important.
And if death does result, would that be a quick death?
That could be a quicker death, much quicker death. I mean, central nervous system depressants at high dosages, high levels, that would kill someone much quicker than the acetaminophen.
Would it be a painful death?
Yes, because the anticholinergic effects.
Now, you indicated you want to take into account factors other than just the tox screens in an investigation of a potential overdose.
Yes.
What about witness statements about the victim's behavior and symptoms? Would that be important?
I think everything is important in every investigation.
If you had a case where an individual passed and their screening showed acetaminophen and diphenhydramine, and it was reported that prior to death, the individual was showing symptoms of having something wrong with them, that they didn't want to talk, that they didn't want to get up, that they were lethargic, tired, and gagging. Would these kinds of symptoms be consistent with being exposed to toxic levels of those two drugs?
Yes.
Is the gagging significant?
Very significant to me.
Tell me why.
Based on my background and experience and having investigated many overdose deaths, in doing my interviews, particularly with parents, and this is, types of cases where kids have used drugs, they came home, they seemed fine, but the drugs were still in their system and they were still going through biotransformation, going through the liver, drug levels were still rising. The family would all go to sleep. This is the story that I heard many, many times. And the parents felt that their child was home safe at home. And what they would hear is this real loud type of snoring on a very infrequent basis. And the parents would think that, oh, my son and daughter are sleeping deeply. And in fact, they were dying. And it's because of agonal breathing. They would go down to sometimes one respiration.
Hey, Gail and Tammy. Hey.
Which is
Welcome,
not
welcome.
conducive with life.
What sort of behaviors might a child be exhibiting if they are going through these symptoms? They've been exposed to toxic levels of one or both of these drugs. How might they be behaving?
You could see agitation. You could see just the person just being out of it because of the delirium. They would feel terrible because of potential toxins building up, because of the liver impairment. And of course, children have less developed livers and they are a smaller package. So the amounts of drug are more significant in a child. But the behaviors would be, anything from excitation to delirium to being out of it. And of course, the respirations, the choking, the gagging, lacking of a gag reflex because of the central nervous system depression.
Could the excited state or delirium cause a child to be sort of difficult to console or difficult to control?
Yes, very much so.
Cases where you have seen overdoses of these kinds, where the subject is actually dead on arrival, they've passed. Do you ever see accompanying blunt force trauma with those cases?
I'm trying to think right now of the different cases, and usually these just pop in my head. In the emergency rooms, no. When I was working, or when I was in graduate school, I was able to be blessed with the ability to attend autopsies with my forensic pathology professor on a regular basis, and we did see blunt trauma in those particular cases. But in the emergency room, I don't believe I saw blunt trauma with these particular drugs.
Could it be possible that a child going through these symptoms, being in an excited state, being upset, being difficult to control, could be struck by their parent?
Yes, I apologize. I do remember one case where we had to have Child Protective Services intervene in the emergency room. And it was with another antihistamine, but that is also a central nervous system depressant. And they thought the child was acting out, and they didn't hit the child with blunt trauma, but the child did have bruising. And again, we had to have Child Protective Services intervene as well as treat the child.
And in your personal experience with these kinds of cases and involving children, have you ever seen situations where parents were giving their children these over-the-counter medicines that induce drowsiness, even when they weren't sick, even when they didn't have a cold?
It probably happens every day.
And what sort of reasons were the parents giving a drug that induces drowsiness, even when their kid didn't need it?
Well, one case in particular, but I know that we had a child come into the emergency room with agitation, sort of an idiosyncratic reaction to Benadryl. The parents had given the child Benadryl so they could sleep, the child could sleep through a flight. And with children, you can get an idiosyncratic reaction where it's the opposite effect, where they become very agitated. It's possible that it could be part of an anticholinergic delirium, or it could be just that idiosyncratic reaction that diphenhydramine specifically has that causes excitation, sort of the opposite of what you.
I have a cousin who, her son, anytime she would give him Benadryl, it would make him literally bounce off the walls. Literally. And I've heard a lot of other people say that they have the complete opposite reaction. And like for me personally, I can take Benadryl sometimes and it make me really sleepy, but it also really messes with the nerves in my legs. Like I have something called restless leg syndrome. Some people, you'll hear it be referred to as like RLS. And it's where you have like sometimes, especially like for me, when I'm really, really tired or confined in a space for too long a time, like in a car on a long ride or in an airplane where I'm having to sit still and not move around very much, that's when I start getting like, it feels like these, like, the only way I know how to explain it is it feels like creepy crawlies, like up your legs, just, and if it gets bad enough, I can even feel it in my arms. And it's not actual creepy crawlies, it's just nerve endings that are something or another. I don't know how to explain it, but it's called restless leg syndrome. And anything with like PM in it, anything that has like diphenhydramine in it or certain things like that will make that worse. And so, like for me, if I try to take Benadryl to help me sleep, it'll make me sleepy, but then it makes my legs act up all the more, and then it's just I'm just miserable. So anyway, Billy says she has that too, uncontrolled twitching. Yep. Not good, not good. Okay. Sherry said Benadryl makes her feel honky. Wonky and hyper. Wonky and hyper. There you go. Tammy says, I've got restless leg syndrome when I did chemo, plus they gave me Benadryl for lungs doing chemo. There you go. Yeah. It just has the opposite effect on some people. But anyway, that was just a side note. I got off topic there. Okay, we're going back.
You'd normally see. And yes, we had a patient, a child come in, but there are unfortunately, parents think that, well, I can give them a little antihistamine, they sleep through the plane flight, they're not screaming, yelling, or crying, and half the time that's usually because of equalization of the ears, because their eustachian tube is at a 90-degree angle instead, but they want the child to sleep, and maybe they want to have a comfortable flight and not bother anybody else in the airplane. But we've seen that many, many times. And even working in a clinical setting, and also teaching, doing continuing educations, continuing medical educations, we've seen, I've seen pharmacists actually tell me that, parents come in and they're going on a flight, they don't want to know what to give their child so that the flight will be, a comfortable flight. But it's not always a good thing to put medication into anybody that may not be needed. And it's just unfortunate that it does happen.
And have you, especially in your law enforcement work, encountered situations where maybe a parent without other resources to help watch their kid sort of use these drugs as a babysitter?
I've seen all drugs used, unfortunately, this way. And I can go into multiple cases that are coming to my mind right now.
Now, she'll ask you if she needs more information. Just answer her question.
Yes.
Cases where the parent needed to work, so they induced drowsiness in the child so they could work, and then the child had to be rushed to the hospital because of a
You
toxic
talk too
exposure.
much.
Well,
No more
unfortunately,
talking for you.
the cases that come to mind, they didn't
They didn't.
go to the hospital. They were dead.
And typically when they don't bring the child to the hospital, is that because there's been an illicit drug involved or because the drug was used non-therapeutically?
Yes.
Thank you.
Cross.
Very briefly.
Good afternoon.
Yes, sir.
So, some of the side effects of acetaminophen or diphenhydramine toxicity could be a child is lethargic, right?
Yes.
Okay. But then at times, a child could be agitated.
That's with diphenhydramine, yes. Potentially.
Okay.
Yeah.
So, but diphenhydramine can also slow the central nervous system down.
It's still slowing the central nervous system down, but we call it an idiosyncratic reaction in that there's no real reason. What you would expect is central nervous system depression, but in this particular case where you have that idiosyncratic reaction, the opposite comes out and they're excited.
You say it's a reaction you don't expect. That's what.
That is correct.
Okay.
Yes, sir.
How common is this?
Fairly common, and it's usually based on the age.
Okay. Now, you also said that there's pain in the upper right quadrant. Is that right?
Yes.
And what's that? Which drug is that from?
I'm sorry, sir.
Which drug of the two is that from? Okay. If a child was given a therapeutic dose of acetaminophen or diphenhydramine or combination of the two, would you expect there to be any pain or adverse reactions?
Pain or adverse reactions with a therapeutic dose?
Yes.
One time?
Right.
No.
What about an underdose or a trace dose? Would you expect there to be any pain or reactions
There might be pain relief,
on a trace dose?
but not expecting any reactions, no. Unless their livers don't have particular enzymes based on genetics, but that's a potential also. So we do look at again, a totality of different things when we look at the way drugs act in the body.
Okay.
And we may do actually some genetic testing for if this person presents, say, in an emergency room or a hospital or a doctor's office relating to this.
So there could be a genetic disorder with the liver that what is thought of as a therapeutic dose or even a trace dose could be serious.
Correct.
That's all I have. Thank you.
Any redirect?
No, Your Honor.
Maybe the witness speaks to you?
Yes, Your Honor.
Thank you
Thank
so
you.
much.
Thank you very much, Your Honor.
All
Are there any
right.
other witnesses for the section?
We have one witness remaining, Your Honor.
Approximately how long do you think that witness will take? Who is it?
Detective, investigative McClinton.
Okay, longer, you think than like 30 minutes, okay. All right, we're close to being done, with the state's case. So it's 5 o'clock on Friday, we're gonna go ahead and, would you mind scooting over? Sorry. I like to just see people when I'm talking about. Perfect, there you go, perfect. All right, we're going to conclude for the day, come back Monday morning at 9 o'clock. The state will have their last witness, is that correct?
Yes, Your Honor.
Okay. And we will take it from there. So we are doing well with time as far as what we anticipated. So we were hoping to finish the state's case today, but Monday morning is pretty darn close. So you have the parking, you got the parking code, everybody get their letters that they needed? Okay.
I'll fill in the line.
You still, okay, don't leave yet. Oh, and juror 41, who's juror 41? That you? No. Who was the juror that came in late section? That was, okay. Hang tight, I just have a question for you. All right, you all are excused, same instructions, especially, it's more important even over the weekend because you don't want to accidentally expose yourself to anything on the news. You don't want to talk about it. Certainly don't research anything, Google anything.
Okay, I'm gonna wait and see if she
Monday morning at 9 o'clock.
gets on to this juror. I want to see what she says to this juror. They may cut it out. I don't know. We'll see. It's only got a couple minutes left in this stream. So, do you remember yesterday? The one juror was like 35 or 40 minutes late. I think that's the juror she's asked to stay back, and I'm wondering if she's gonna jump onto him for anything. We shall see. We shall see. She did mention something about checking to see. She wanted to ask him if he was working at night. And she said if that was the case, because I don't know if she thought that he was like asleep out in his car and missed the alarm on his car, on his phone or whatever. So, oh, well, it went off. Let's see. Looks like that may be it. Looks like it. So, okay. Alrighty then. So, now we are caught up with the trial. Finally. We're caught up. Yay! Monday morning at 9 a.m. Tomorrow morning at 9 a.m. Eastern. They will resume. Apparently, state has one more witness. And the state should be done with their case. And then we'll see what the defense has up their sleeves. We'll see. And we'll kind of play that by ear, what happens with that. But, all right. So let's scooch over into, I don't know yet, Tammy. They haven't said anything yet. I guess we'll find out Monday or early in the week. Okay, yeah. Sorry about that. Okay, so how many of you in the chat are familiar with the Savanah Soto and Matthew Guerra story? The Savanah is the 18-year-old girl from San Antonio, Texas, who was pregnant and missed her appointment at the hospital to be induced. And they find her and her boyfriend deceased in his vehicle. Okay, Henny says a bit, Tammy says me. Gail says nope. Okay, well, then why don't we just kind of start, we'll do a little bit of a rundown on it, just to kind of catch you guys up, right? Kel's like, me, I know. So, let me, let me go into my notes section, because I thought that I had some, no, that's not that. It may have been the notes on my phone. Let me see on my phone. Okay. All right. So let me hold on just a second. I'm going to how long is that? That one's 15 minutes. Okay, no, that's not what I wanted. So I'm going to email this link to myself so that I can open it from my computer. And it's not what I wanted to do. I wanted to compose a new one. Okay. Paste. All right. So let me run over here on my computer real quick. See if I can find it. I should be able to anyways. Sherry said she's heard a little, and Billy says no. All right, you guys. All right. So it's a really, really sad story. It's really sad. Let me open this link up here. And let me go to the end of this video, because at the end of this video they give a little bit of detail about it. Oh, it's being stupid. and slow. Oh, come on. It's not going to work for me. Let me go over here to Facebook then. All right. So, okay, hold on a second, you guys. Sorry. Thanks for being patient with me. Hi, Nicole. How are you? Oh, Nicole says she's happy she found my new channel. Well, I'm glad you did too. I'm glad you did too. All right, so Nicole, we're just chit-chatting about the Savanah Soto and Matthew Guerra from San Antonio, Texas. Here is a press conference that I found where they arrested the people. But I can't remember if they go into detail like from the beginning about what actually happened. But let me go ahead and share this screen with you guys. All right, and then so here it says San Antonio Police Department Chief William McManus and Bexar County DA Joe Gonzalez providing update on the capital murder case of Savanah Soto and Matthew Guerra. So I'm going to play this presser, and this one just came out a couple of days ago. This was after they had made the arrests. So
Good morning. I don't know if this is going to affect your sound enough. I'm going to cover up some of these mics here. What's up, Dylan?
let's see if I can pop this out and make it bigger.
Thanks for thanks for showing up. Obviously, come on up here, guys. I've asked
There we go.
District Attorney Joe Gonzalez to be here today and make a few comments at the end of this briefing, and we'll make this short and sweet. I have most of the information I have here I think you've already been privy to. I do have a little bit of new information. The information I'm going to give you, I will answer questions to clarify, but I'm not going to go into a lot of detail about anything else, simply because this is an open investigation and we still have a lot of work to do. So again, my condolences to the families of Savanah and Matthew. By now everybody's aware of the incidents, so I'm not going to spend a lot of time rehashing facts that are already known.
Okay, well, wait, let me stop them.
High level. So
let me stop then. If they're not going to go into detail, then let me go find let me just go find a news article, and we'll go through that together. Okay, let's see if I can find you guys just chit chat amongst yourselves for a minute while I look this up, because I would like to find an article that is older but has been kept updated with new updates. So, you know what I mean? Okay. La 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 la. La 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 la. Okay. Okay, we can go with this one. Let me share this. Let me share this page. Share this tab instead. All right, let me make sure you guys are seeing it. And let me, well, hold on. Let me, well, hold on. Shoot. Add. Okay, there we go. There we go. That's how I wanted it. All right, so I'll just start scrolling through here and we'll kind of read through it a little bit. This is on the People's, let me copy and paste this link real quick though in here. Just because I want to share the share the, where it's originated from. So anyway, all right. After the pregnant teen and her boyfriend were found shot to death in car, father and son are arrested. Now, the father and son were finally arrested like several days later, right? And they were, there were so many theories going on about this case. So many different theories all over the internet. Things were flying left, right, center. There were videos being torn. Like there was, because the police had come out with a like CCTV footage video of this vehicle, this truck meeting the victim's car. And like different people like completely shredded that video apart and was trying to like find every little clue detail in that to locate who it was, right? That committed this horrific act. But anyway, Savanah Soto, who was 9 months pregnant, look at her. She's the lady here in the middle. She's this young woman here in the middle. And then the perp on the left, his name is Christopher Preciado. And the perp on the right is his father, Ramon Preciado. Now, the guy here on the left is the one that shot and killed her and her boyfriend. In turn, her unborn child also passed away. But she was like on her way to go to the hospital to be induced. She was like a week overdue, I think. Let me know if I'm coming in, if you guys can see and hear everything okay. Because I don't want to be sitting over here talking and because I can't see the chat whenever I'm like reading this stuff. I just want to make sure everything's cool. Right. I'll wait on you guys. Okay, good deal. Okay. Thank you, Gail. Thank you. Okay. So, okay, here we go. 8 days after the pregnant teen, she was only 18 years old. Okay. 18 years old. 8 days after a pregnant teen and her boyfriend were found shot dead in their car, a father and son have been arrested in the Texas Capitol murder case. So here they're talking about the awful, horrible people. But this is, we're going to kind of go back to it. I'm going to kind of go back to it. I kind of want to start from the beginning for the people that don't know for sure what's going on. This is a picture of Savanah and her mama. And can't tell where they're at. Where are they at? It looks like they're eating somewhere, but cute photo, right? Let's see. This is a picture of Savanah and Matthew Guerra. This is at their baby shower. This is her boyfriend that was also in the car, murdered along with her. Another picture of her. This is the video I was talking about earlier. I'll play that for you guys here in a little bit. But and this is another like picture of the man that gets out of this truck and the guy that gets out of this car, which for a long time, a lot of people were thinking that the person that got out of this car was a female because they had long hair. And it looked like their hair was in a ponytail. But now we know that Christopher has long hair. And at this point in time, Savanah and Matthew are in this car already shot. And they're going to dump this car. This is when they are arrested. So let me go back up here to the top because there was a related there was a press conference there related. Let me click this, open it in a new tab, and see. Okay, this was a preview. Okay, this was posted on the 27th of December. So this is an earlier. All right. Here we go. I think I read this article the other day or one similar to it to you guys. Let me share this tab. So, yeah. Okay. So we'll go through this one first, and then we'll go back to the other one. A day after missing pregnant teen and her boyfriend were believed by police to have been found dead in a car in San Antonio, police announced each suffered a gunshot wound, according to multiple reports. There are 2 people in the car. They are deceased, San Antonio Police Chief William McManus said at a Tuesday night press conference, saying that the authorities believe the bodies belong to Savanah Nicole Soto, 18, and Matthew Guerra, 22, NBC News reported. McManus said the scene was perplexing. On Wednesday, the police department said both victims had suffered a gunshot wound, and also added that an unborn child was also pronounced dead at the scene. Soto was reported missing Friday after she missed an appointment to induce her labor. So she had actually called her mom and told her mom the night before. She said, "Mom, make sure that you are at the hospital on time. You know, I don't want to be having to wait and worrying that you're going to miss anything, you know." Later on, we hear that inside the doorway at their apartment, she had her like hospital to go bag like packed and ready and all of that. So, but Soto was reported missing Friday after she had missed her appointment to induce her labor. Tuesday night, police said they're investigating the incident as a possible murder because they did for a while think that it could have been a possible like murder-suicide. That wasn't out of the realm of possibility at the first stage. She had told everybody sorry, I misread that. She had everything ready for her little boy, Soto's mother told KNS 5 before the body was discovered, and that Soto was thrilled and excited about being a mom. So, okay, that was that. So now you know what had happened there. And then, like I said, we start getting all this information, right? I want to go back down here to where the press conference was. This photo, where was that? Here we go. Previous press conference. Hold on, guys. I'll bring you up with me in just a second. I know, Gail. It's so sad. Let me share. Let me share this tab. Now, this is the press release on December the 28th. San Antonio Police Chief William McManus providing an update on the Capitol murder case from December 26th on the 5900th block of Danny K Drive. Yeah, it was on a Danny K Drive was the where they were found the day after Christmas. But they had first been considered missing persons from like the 22nd of December on. It was like a good 2 or 3 days before they actually found the car with their bodies in it. And so, their families were worried to death. I mean, what kind of a Christmas was that, So I'll go ahead and play this. Give me thumbs up and let me know if you can hear it, okay? When it starts. Hold on a second.
Because this is an open investigation, I'm not going to answer questions unless it's to confirm something I've just said, but I'm not going to answer questions that may get into the details of the investigation. So first of all, I want to extend condolences to the families of both Savanah and Matthew. I also want to reassure them that detectives are doing everything that they can do to solve this case. Savanah Soto and 22-year-old Matthew Guerra were reported missing by Leon Valley on 12/23/23. A clear alert was issued for Savanah by DPS because it met the criteria for a clear alert to be issued. CLEAR stands for the state's Coordinated Law Enforcement Adult Rescue Alert Program. Families of both victims reached out to SAPD on the 23rd to make a police report, but we had learned that Leon Valley had already taken a missing person report. Savanah and Matthew resided in Leon Valley's jurisdiction, and were last seen in Leon Valley. Therefore, Leon Valley was the reporting jurisdiction. Officers did document details provided by the family members under an SAPD information report. On the 26th, at about 4 o'clock, SAPD was called to assist Leon Valley PD at 5903 Danny K. Leon Valley was requesting assistance. Families of both victims were at the location and reported to Leon Valley PD that earlier in the day, they received information that the missing gray Kia Optima was at the Danny K address. When police arrived, they discovered 2 people in the Kia. EMS was called to the scene, and they pronounced both victims at the scene. It appeared that the vehicle had been located at that location for several days. The medical examiner had identified 22-year-old Matthew as one of the deceased victims in the vehicle, and he died from a gunshot wound to the head. The manner of that death is still pending. The second deceased victim has not yet been officially identified by the medical examiner. However, I think we can be confident that that second victim was Savanah. This case is being investigated as a capital murder case. Detectives right now are combing through days of surveillance video from several different locations that the victims were known to be, where the victims were known to be. Detectives are hopeful that surveillance video will lead to the events leading up to their death. Detectives are also combing through social media and cell phone records to determine the last communications with the victims. We have a video here that we're going to share with you. We have already put it out on social media. You may have already seen it, but we're going to run this video here today. We are hoping that someone is able to identify the individuals that are seen in this video. If anyone has any information regarding what they may see in this video, we would ask that you call homicide on 207-7635. You can remain anonymous. You do not have to give your name. The video was taken from a nearby location where the bodies were located. And finally, here is a slowed down image of the first person of interest getting out of the Chevy Silverado that is seen next to the Kia. And then here's another, there'll be another slowed down image of the second person of interest getting out of the victim's Kia Optima. Once you've looked at the video, I will take a few questions, again, only to clarify what I've said if you're not quite sure about it, but I will not take questions other than what I've just talked about because the investigation is still active.
Chief, you said the ME said that for Matthew Guerra, it was a gunshot wound to the head, but when we called them, they said it's a contact gunshot wound. What does that mean?
It means that it was there. When we talk about the manner of death has not been determined, the manner meaning, was it a suicide or was it a murder? So that's what the ME has yet to officially put out.
So there's a possibility that this could be a murder-suicide?
That possibility exists, but right now we don't believe so unless we get information from the ME that would change our current course.
You don't believe so, and I wonder the callousness of all this. What is your message to the person or persons who may have committed this?
You know, somebody asked me that the other night, and I don't know what value that adds to this interview, what message I would put out. I mean, clearly, it was a heinous act. It was, you know, unspeakable, the tragedy of it. I mean, what message would I give to those folks? I mean, I don't see what the value of that question is, but anyway.
And just to clarify, you were treating this as a homicide for both people?
It is a capital murder investigation.
For both victims?
Yes, right now, unless we get information that changes that.
And Chief, when was this surveillance video? Is this from the 26th?
Say it again?
Where and when was this surveillance video taken?
A few days before.
Yeah.
The bodies were discovered.
And where was this? What's the address of this area?
Where what?
What's that? Is this where the bodies were discovered?
Very close to it, yes.
Very close to it.
I do see, I believe he is handing something to the driver of the pickup truck. Do we know anything about that?
I mean, that's what we're looking at. What we believe right now, it was something to wipe the side of the car down with. You know, we can't be 100% certain with that, but that's what we're studying in this video, and that's what we believe right now.
And do we believe that these people may have any links of some sort? Do we know what links they have?
I don't know that, and again, would be part of the investigation.
So just to be clear, the vehicle, the Kia Optima, that's the vehicle that they were found in?
Yes.
Okay. But the person that's getting out of the vehicle, you're saying out of the Kia Optima, is there somebody that gets out of that vehicle that you're trying to say?
Yes.
And you don't believe it to be either Matthew or?
No.
Okay.
So
correct.
do you all believe that they were shot, the killings happened somewhere else and they drove the car and dumped it?
Well, you know, again, I don't want to get into the details other than what I've talked about here today. So the answer to that question would be yes. But other than that, again, I'm not going to answer questions that are outside of what I just talked about.
So in this video, do you think that they're dead or alive?
Pardon?
In this video, do you think they're dead or alive?
Again, I'm not going to get into that.
And then one other question, the day of the crime scene, you called it perplexing. Now you've learned a couple more details. Can you go into why you use that word?
Because it was unknown at the time. I mean, we had been there not very long at all, and it was undetermined at that time whether we were going to be looking at it as a murder-suicide or as a capital murder investigation. So I think we've kind of gotten past that point right now, unless we get evidence that would lead us to believe otherwise, but I think we're past that point right now.
You said the bodies have been there for several days. How many days exactly?
I don't know exactly, but they'd been there for a few days, I'll say.
So what took you so long to find the car if the car was parked there for several days?
What took us so long to find it?
Yes, if the car was parked over there for like several days.
Nobody came across that car.
Thank you.
Thank you.
Okay, so that was the first press release, I think. I don't know if there was another one that was done when they were considered missing persons. Sorry, my eyes are just watering and I keep. Anyway, so there is that was that one. Now let me go to hold on, let me click on this and see if I can see how long it is. I don't know how long this video is. But I really want to see if I can get it to play over here on Instagram, because that's where they're sharing the video from. Okay, hold on, you guys. Thank you for your patience. Okay. Back up here, back up here, back up here. Okay. Now I have to come back over here. Gail says that was a stupid question. What took them so long to find the car? You mean what took them so long to find the car was the stupid question? Or are you asking what took them so long to find the car? Just so I'm clear, Gail. Just so I'm clear. If it isn't one thing, it's another. Hold on a second. Okay, now I'm trying to locate. Now present, share this. Okay, so this is the San Antonio Police Department's Instagram, and this is the video. Here you can see. I want to see if I can. How do I make it bigger? If I like plus size it, does that help? Or that don't really do anything. Okay, let me go back. That didn't really do anything. Happens, go to post, copy link, embed. Okay. Well, let me X out of there then and maybe show it from here instead, because you can get a wider angle view on it from here. All right. So I'm going to go ahead and click play. There is no sound. But you can see what happens if I make it bigger here. Okay, I think that'll help. Or maybe it won't. Anyway. That's a little bit better, maybe. Okay. All right. Now, I'm going to go ahead and click play. So you can see from the right side, there's a dark, like, Chevy truck that pulls up. And then from the left side, you'll see a little Kia, I think they said Optima, come in from the left. And they, like, meet, okay? Hold on, I got to turn my phone down or off. So you'll see the truck come in and then the car comes in, right? And you'll see a heavy-set person get out of the truck and do some like fiddling around. And then he gets back in the truck and he drives off, and then the car drives off. So keep in mind, at this time, Matthew and Savanah are already both deceased in the vehicle. The guy driving the vehicle is the one that shot them. And the guy in the truck is the guy that shot them's dad. And so we find out after this video has been released, because this is just like security footage video at a set of apartments that the cops were able to get. And the kid, Christopher, when these two separate and leave at the end of the video, you see the car drive away, and it actually goes from there around the building, which you're not going to be able to see it, and parks the vehicle. And then he gets out, which we don't see any of that. But that's what happens. And then it's like 2 or 3 days later before they locate this vehicle. But this vehicle is like so many miles away from where Savanah and Matthew live. And they have no connection to the set of apartments where this vehicle is found. So, okay, now I'm going to play it. I'll try to find a bigger blow up of this video so you can see it when this is done, because it's so tiny right now that it's impossible to see. But you see the guy in the white shirt, that's the dad. And there's actually another person in the truck. You don't see that person, but you see that person throw the dad a towel. So after further investigation, now they're saying that there's a second. Okay, see, they made it a little bit slow motioned it and brought it in closer so you can see it a little bit better, but it's still not great. Just helped hide the car, Gail, as far as we know. But I would really like to find a better video. Maybe this one. Okay, no, that's not what I wanted. I wanted this. Okay, hold on. Let me share this tab. And scooch it. Okay, here we go. Let me get rid of myself so you only see the video, and then I'll play it again a couple of times so you can catch it. But I'm going to take myself off the screen. If I can hold on. Okay, there we go. That works. That works. Okay. So the dad just got back in the truck. Now, I'm going to click watch again. I've seen this video a bajillion times. Okay, Dad's pulling up. Christopher's pulling up. Looks like Christopher already had the door open. He did. Dad gets in the car. Christopher steps out here in a second. And then did you see that just then? Hold on. If you look in the back seat of that, like right there, you can see somebody is wobbling around a towel, a white towel. There's somebody in that passenger seat. See? He opens the door. And there's Christopher. He just jumped out. I paused it so you can see. That's Christopher right there. They're wiping off any fingerprints, DNA, blah, blah, blah. Dad gets back in the truck. He takes off, and he is going around the other side of the building. Here's another close-up view. Slow motion, Dad gets out. And you can see, watch, you'll see a towel. See? Oh, wait, no, it didn't show the towel. No, it didn't show the towel again. But you could see the towel. Ay, ay, ay. So, anyway, now that you've seen that, what do you guys think? I mean, could you see the towel? Could you guys see the white towel flopping around there? I mean, did it not look like there was someone in the passenger seat of that truck? That was like, here's a towel, you know. The start almost looks like the muzzle flash in the car. Must be light reflections. Yeah, I think it was because at that point, it was already done. I can't remember. It seems like there was some sort of conversation about when or whatever. The police actually have like times based on their phone records or whatever. And the thing is this all happened. I think in one of the press releases or somewhere, someone had said, it's floating around, that this all happened from like start to finish in 9 minutes. That he met with them, they were shot, dad came, wiped, cars took off, parked in 9 minutes. And it happened right around like midnight that night. Oh, they did mention that. The light reflections on the car door. Somebody said it was, I think someone said they thought it was like a pole light. Or something, some sort of like light reflections from a street light, or I can't remember. But they were talking about that too. Gail says, I'm watching on my TV and it looks like there is someone else there, a third person. I agree. Definitely is, because you can see a white towel. Like, the white towel moved inside that truck. And he grabs it. And unless he's a magician, you know. So, okay. We watched the press release. We watched the surveillance footage. That's the dad, Daddy-O. That's the night he got arrested. Let me go back up here. All right, here. So the father and son were arrested. Sorry guys, I need to share the screen with you guys. People, present, people. Share. So you guys have questions. Are they related to the couple? Not that. The only thing I know, Billy, is that they're saying that it was like drug related. I also heard that she was in the business with him because she was with him and got all the benefits of the monies. Yeah, I heard the same thing. Yeah. I agree. I think so too. From everything that we've seen. I mean, I don't know that to be a fact, but according to all the like photos and their social media, it's obvious that she knew what he was doing. And how much of it she was actually involved in footwork wise, I have no idea. No clue. But so let me get back to this here. Christopher Preciado, 19, is charged with capital murder in the connection of the deaths of Savanah and Matthew. Ramon is charged with abuse of a corpse. This is the dad. Ramon, 53, is charged with abuse of a corpse after allegedly helping his son discard the vehicle with the couple's dead bodies inside. The father and son were escorted by the police officers in a late-night perp walk, which was followed by a videotaped press conference where San Antonio Police Department detailed the January 3 arrests. So I do want to watch that because there was a very small press release after the perps were walked out in handcuffs and all that jazz. And here it says a reporter shouted, "Why did you do it?" as Ramon Preciado was put into a police vehicle surrounded by journalists. Mentions of Soto's unborn baby were yelled before both father and son were driven away from the police precinct. I remember hearing the dad say something about fake news. So I don't know what he meant by that, but and you'll hear him say it here in a bit when I play it. We do expect more charges to be pending. Washington Moscoso of the San Antonio Police Department said at the press conference. When asked specifically about any additional charges regarding the death of the unborn baby, Moscoso nodded, saying, "Our detectives are going to do everything they can to bring justice to the family." Soto was the first reported missing in Leon Valley, Texas, by family December the 23rd, after the overdue mother missed her appointment to induce birth. Investigators located their missing silver Kia Optima at an apartment building parking lot on Danny K Drive in San Antonio the day after Christmas. And Guerra was found with a gunshot wound to the head. Nothing that the gun had been... Oh, wait. Sorry. Guerra was found with a gunshot wound to the head, Chief McManus said, noting that the gun had been pressed to his head before the trigger was pulled. Soto had also been shot. So that's what he was saying. It was a contact wound. Clearly, it was a heinous act, the chief said. Unspeakable, the tragedy of it. And now the couple's... And police now say the couple's execution-style death seemed to be linked to a botched drug deal. It appears that it was a drug deal, Moscoso said at the press conference, announcing the charges in the capital murder case. He added, "Someone was buying and someone was selling." Soto's shooting death, and listen to this, you guys. This is another sad aspect. Soto's shooting death, Savanah, comes just 19 months after her brother, Ethan Soto, was shot dead at 15 years old. So Savannah's younger brother was 15 years old and was shot dead literally like a year and a half. Before she died. I know, Gail. Did they see the tags on the truck? I don't think that they were able to get the tags on the truck. The video wasn't clear enough. The way they found the father and the son was, they finally got the warrant to search Savannah's phone. And inside the phone was a Google location that had just been used. Like the last Google search was the address to, I think, the Christopher guy's house. And yeah. That's how they found it out. But see, they had to wait for the search warrants before they could, go through her phone for any, like evidence, information, that kind of thing. Here, investigators developed a lead after reviewing surveillance footage allegedly depicting the father and son meeting to help discard the bodies, according to police. Police released the footage on Instagram and Facebook in December, trying to garner more clues. In the footage described by the chief at his press conference, Ramon is seemingly depicted getting out of the truck and passing to his son something to wipe the car down with. They said weigh, but I think they meant wipe. Before Christopher allegedly drives off in the couple's Kia. In the days after the recovery of the couple's bodies, investigators went to a residence associated with the father and son. The father answered the door. Moscoso said at the press conference he knew why the police were there. Ramon cooperated fully with the investigation, adding that interviews with the father and son led to a warrant and their ultimate charges. Christopher had no criminal history, according to Moscoso, who characterized the father's criminal record as small. Apparently, the father owned a HVAC business. That's really all I know about him, about the father. It says there was a lot of misinformation out there the early stages of the investigation. These two individuals are the only suspects we were looking for, he added. There were many names being thrown around on the internet. Those people had nothing to do with this. And so that's what I was saying. There was a lot of name dropping, a lot of blame gaming going around. I mean, yeah, it was pretty crazy. How they were... like literally when the surveillance footage of this truck came out, they said that they were like eyeballing, like people, just the public were like eyeballing and pointing fingers at every heavy-set man in a Chevy Silverado or whatever. And they were blaming like ex-boyfriends, girlfriends, ex-friends, this, that, the other. It was crazy. I want to go back though and watch this perp walk with you guys. If I can locate it again, it was up here somewhere. There it is. Here it is. Oh, wait, but I think I have that already over here. Let me see. No. Where did I have that at? I had that somewhere, I thought. I guess not. Okay. All right, then we'll go back here and press play. Trying to see if I can make this. There we go. So, this is kind of long and drawn out, so I will try to skip through it. Hold on, let me X out some. I'm going to try to scooch past so we're not having to wait, but it's not going to show me the whole thing. Like, I need to, it's not like, okay, there we go. There's the dad. Here's the dad coming out. They bring him out first, but listen to him. You'll hear him say something about fake news, fake news.
Why did he do it? Are you sorry for what happened? Did you know Savanah was 9 years old?
Make a hole, guys.
Okay. That wasn't the one. That wasn't the view that I saw was a different angle, so it was from a different cameraman. But yeah, somebody had mentioned, why did you do it? What did you? And he's like, something like, yeah, fake news, which was crazy. If I can find that version of it, I'll find it. But I want to go to where the boy walks out, Christopher, and then I want to get to the last little few minutes of it where the cop does the little quick like press conference at the end. Okay, here's the boy.
Está saliendo el segundo.
That's him there with the long hair. Right there. All right, now.
December 20th.
Okay, here we go.
Be a narcotics. Interrogations might be. So am I going to go?
Good grief. All right, here we go.
Good evening, everyone. I'm Sergeant Washington Moscoso, WASHINGTON MOSCOSO. So the individuals you saw this evening, the first individual's name is Ramon Preciado, 53 years old, SID number 443651. The second individual was Christopher Preciado, 19 years old, SID number 1191061. So the two individuals we just walked out today, again, is a father and son. The first individual is a father, the second individual is a son. They're going to be charged, the son's going to be charged this evening with capital murder, and the father's going to be charged with abuse of a corpse. So we do expect more charges to be pending. So I'm not going to go into the whole thing. We all know what kind of led us to this, to where we are today. I will say that when we recover, or when the bodies were discovered on Danny Kaye, obviously the investigation began. SAPD detectives made that location and started collecting evidence. One of the key pieces of evidence that we did collect at the scene was Savanah's cell phone, and that was handed over to our technology team, who was able to download some information on there. With the assistance of the U.S. Secret Service, we were able to get enough information, and so that information was given to our detectives today. With that information, the detectives were able to find a possible location of where the suspect vehicle that was released on that surveillance camera, the surveillance video, possible location where that suspect vehicle might be. They made that location, and sure enough, the vehicle was there. They did a little bit of surveillance on the video, or on the vehicle, and then were able to determine which house it belonged to. They went up, knocked on the door. The first gentleman, the first individual, the father answered the door. He knew why the police were there. Was cooperated fully with the investigation. We're right here to headquarters, and our detectives were able to start interviewing both the son and the father. Again, they were both at the home. They were both brought down here, and the interrogations began. Through interrogating the individuals, our detectives had enough, based on what they said, there was enough information there to get a warrant signed by a judge tonight, again, to charge Christopher with capital murder and Ramon with abuse of a corpse. Again, there will be more charges pending. This is what we have right now. I'll answer any questions that you might have.
Due to the capital murder for the son and then use of the corpse charge for the dad, does that mean that you guys believe the son killed them and then the dad helped hide the body?
Yes, yes. And so I want to touch base on something real quick. Since the release of the video that we put out on the 28th, there has been, internet has blown up with people sending tips and people just sending misinformation. There's a lot of misinformation out there. These two individuals are the only suspects that we were looking for. They were arrested. There were many names being thrown around on the internet. Those people had nothing to do with this. We vetted them and everything. They didn't have anything to do with these murderers. So the individual, again, Christopher, we believe committed the murders of Matthew and Savanah, and then Ramon helped kind of dump the body. It appears to be a narcotic-related deal that went bad.
Do we know the connection between this father and son and Matthew and Savanah, or the connection to the apartment complex?
So there's no apparent connection to the apartment complex. It's just a place where they went to go dispose or hide the vehicle with the bodies in it, and it appears that it was a drug deal. So there was like a drug connection to the suspect and the two victims.
When you say abuse of a corpse, can you talk about that a little bit? Was there any mutilation, or is that?
It's just when you hiding the body, moving the body after discovering that and all that kind of stuff. Yep.
When he killed them, what exactly?
So December 21st, which is a Thursday, just before midnight, is when the actual murders took place. On that. Mm-hmm.
And are they going to be charged for the baby? Because in the state of Texas, technically, they could be charged for a third.
Right. So like I said, there's going to be possible charges pending, more charges pending. Our detectives are going to talk with the Bexar County DA to determine if they're going to be any charges facing. They're going to be facing any charges related to the unborn baby.
And do we know if she was dilated at all?
I didn't have that information from the medical examiners. I know that she was scheduled to be induced. And she didn't make her appointment, which is why the family went to the police to file the missing persons report.
Did he say where exactly they killed them?
I don't have exactly location. We just know that they were killed at a different location and then taken to the apartment complex to dispose of the vehicle and the body. I know there was some Spanish questions I wanted to knock out real quick.
Sí, podría darnos un resumen pequeño para la audiencia hispana de estas personas que presentó.
No vamos a hacer preguntas. Nada más unas preguntas. Si tienes preguntas a particular.
¿A quiénes presentaron esta noche?
Sí, esta noche el primer señor que salió es Ramón Preciado, de 53 años. Y el segundo es Christopher Preciado, de 19 años.
No, I can't.
Christopher Preciado es el que hizo los asesinatos.
I don't know Spanish, so I don't know how to translate any of that part.
Su papá, Ramón,
if anybody in the chat knows, you're more than welcome, and please do tell us what they're saying, because I have no idea.
Las dos personas eran las que aparecían en el video de vigilancia que presentaron la semana pasada.
Sí. Ajá.
¿Había un motivo para matarlos?
Parece que había una transacción de drogas que no fue mal, la transacción de drogas fue mal y resultó en la muerte de las dos víctimas.
When you say drug deals, you mean were they buying or selling? Do you know what?
Well, I mean, someone was buying and someone was selling, so it was a drug.
Can Ramon be charged with these murders through the accomplice theory or the multiple parties theory?
I'm sorry, could who?
Ramon, the dad, could he be charged with the murders as well through an accomplice theory?
No, he was not. He was not there during the commission of the murders. He was there kind of, I guess he was called afterwards to help dispose or help his son. I'm sorry?
These two have previous
Christopher has no previous criminal history, and Ramon did have a small, he had some prior criminal history.
So are you all done looking for suspects at this
Yeah,
point?
we don't have any other suspects that we're looking for.
And then that surveillance video, were they alive during that surveillance
No.
video? They were not alive?
They were not alive, no.
Last question, guys.
Christopher killed them and then moved the bodies to the car?
Correct. Well, I mean, I don't know if you moved them into the vehicle, the vehicle with the bodies in.
No, he says that there's not any other suspects, but I think that was a little bit too quick to say that, because there is a possible third.
Was driven to that apartment complex. It didn't happen at that apartment complex.
So ultimately, who's going to make the decision on the final charges? Is that going to be the DA's office?
Correct, yes. So our detective, again, tonight are charging them with Christopher with capital murder and Ramon with abuse of a corpse. They are working on some other charges that they're going to file. But regarding, I think specifically the question that you had about the unborn baby, they're going to have a conversation with the DA to determine whether they can charge or put the baby as another victim on this.
So does SAP have any say whenever they talk to the DA's office?
Yeah, absolutely. Yeah, it's a collaboration with our DA's office.
Would you say SAPD is going to seek that third charge for the unborn baby?
Our detectives are going to do everything they can to bring justice to the family.
Thank you, guys. Thank you so much.
Thank you all for coming out tonight.
Okay, so there's that. And I wanted to go back to this presser, which was the second one. So this was the second press release.
12/26/23, our officers discovered 2 deceased individuals in a Kia Optima, and our homicide detectives at that point began their investigation.
Hi, Susan.
Right on that scene.
Welcome. Hi.
Detectives learned that both victims were involved in the sale of narcotics and used their cell phones to conduct much of their business. Detectives collected the victims' phones, and with the help of the United States Secret Service, we were able to extract information that led to the development of a possible location of a suspect vehicle that was seen on the surveillance video. That occurred on Wednesday, 1/3/24. Detectives drove to that location and saw the suspect vehicle. They approached the home where the suspect vehicle was, and they knocked on the door. An individual by the name of Ramon Preciado answered the door and seemed to know why SAPD was there and cooperated with the investigation. Both Ramon and Christopher were home and brought to the SAPD homicide office for questioning. During the interviews, both suspects made enough statements to implicate them in the murder. Detectives walked warrants for their arrests. Christopher was arrested on the charge of capital murder. Ramon was arrested on the charge of abuse of a corpse. Yesterday, 1/4, more charges were filed. Christopher was also charged with abuse of a corpse, altering, destroying, or concealing evidence of a human corpse. Ramon was also charged with altering, destroying, concealing evidence, human corpse. Detectives also conducted a search warrant at the home of the suspects where evidence was recovered. There is still an active investigation, and I'm not going to go into too much of the details, as I've previously said, because I don't want to jeopardize the integrity of the case or make the DA's job any harder once he gets involved in it. The final piece of information I have for you is that the gun believed to be the murder weapon has been recently recovered from the suspect's home, and we'll share that with you. And Joe, would you like to say a few words?
Thank you, Chief. Good morning, everyone. First, I want to thank Chief McManus.
There were questions about whether the gun that was found was actually Christopher's gun or possibly his dad's, or if it was Matthew's gun, because Matthew's social media, like, there were very big bunches of social media pictures that he posted on TikTok and everywhere of him holding guns. And so I don't know. I don't know if they say here or if they've said and I've missed if the gun was actually, like I said, Christopher's, or if it was indeed Matthew's gun. But can you guys imagine having, as a family, having to go through this, let alone having to go through this during the holidays? I just cannot fathom, just can't fathom. Susan says, hello, everyone. I'm so glad I finally found you all. Like, watch true crime. Well, good. I'm glad you found us. Yay! I'm glad you found us. We like talking true crime too. All right, so I'm going to go ahead and play this again. Start it again.
For inviting me to be a part of this press conference. Before I begin, I also want to extend my condolences to the Soto and Guerra families, as they are in the midst of mourning. They are in the midst of grieving for the loss of their loved ones. So I think it would be appropriate for us to give them the respect that is due them during this period. But I do want to say that as I mentioned before, arrests were made. I was confident because I knew the kind of work that happens over here. I know the kind of dedication that the San Antonio Police Department has. They would identify suspects and make arrests, and that's exactly what happened. So I want to commend Chief McManus. I want to commend the entire command staff, and I especially want to call out the lead homicide detective for doing an outstanding job. I'm sure as typical, he may have had others assist him, but I know that his team was working around the clock, and it made a difference because we always want to formulate a suspect as soon as possible. We always want to identify someone who is a perpetrator of a crime as soon as possible, and that happened here. So again, my gratitude to the entire department and specifically to the detectives that were involved in this case. As I have said recently, our job is just beginning, but we have to give SAPD time to complete their investigation. What they do when they, and the term is walking a warrant, when they present an affidavit for an arrest warrant, they only need to present probable cause to a magistrate judge, but that's only the beginning. They have the responsibility to complete the investigation, and I know that they will do that. They will do an outstanding job as that they've done so far. So let's give them the time to do what they need to do. We have 90 days to indict these cases, and so I am sure that they're going to get a prosecution guide, which is the term that we use for a complete file. I'm sure that they will get it to us in the appropriate time and before that 90-day timeline. So again, I want to commend everyone involved in the San Antonio Police Department for doing an outstanding job in identifying suspects and making arrests. Let's let the detectives complete their job. Let's let them file the cases in our office, and then we'll make the charging decisions, and we'll go from there. And again, I can't overestimate this. In order to bring justice to the memory of these two victims, and in order to bring justice to the survivors and the family members. It's going to be a long road, but we have to take things one step at a time. So let's do that. Let's let SAPD do their job, and then we'll need some time to review the facts and make those charging decisions. And once the case is indicted, then we'll go to the next step. And I'm sure I will have questions about this. So let me get this out there right now. There have been questions about whether or not this will be something that we will seek the death penalty on. It's too early to tell. I don't know whether or not this is something that we will make that decision. We'll cross that bridge when we get to it. As in every other case where we have a defendant who is death penalty eligible, we have a capital crimes committee that will meet, that will make, we will hear a presentation from the lead prosecutor in the court where this case ends up, and then we will discuss the facts that go into making a decision to seek the death penalty. But again, it is too early to tell. We don't want to put the cart before the horse. Let's wait till we get an entire case filed in our office. And once that happens, I anticipate that we will have indictments returned, but we have to wait and let a grand jury make that decision. But after that, then we will take it to the next level and make whatever decisions that we need to. Thank you very much.
I'll take a few questions.
And for the gun that was recovered at the suspect's home, have you guys done any tests, run ballistics on the gun to see if there's been any other connection to crimes?
I will just say that we believe it's the gun that was used in the murder. As far as the testing and the ballistic results go, I'm not sure quite what they have yet.
Chief, can you help clear something up on the surveillance video? We've had a lot of people reach out. It appears as if someone tosses the towel to Ramon Preciado before he wipes down the door on the sedan. Is that how it played out? What can you tell us about that small part of the scene?
Yeah, that's something we're still looking into. It's something that's been brought up in conversation about this, so we're still looking into that.
So that could potentially be a third suspect or someone that was there while the bodies were dropped off at the apartment?
As the investigation continues, it could be. I'm not saying it is. I'm just saying it is possible.
If someone was there, if there was a second person in that truck, could they be charged with the same altering of a corpse or, essentially moving the bodies? Is that how the charge works?
They could be, but I mean, that's something that would be determined once the level of that person's involvement is understood, if that is the case at all.
We saw videos of police activity in the house of the Preciados where you take the mom. Are you questioning her?
I'm going to leave that question unanswered. Okay, thank you, everybody.
Okay.
Appreciate it.
Sorry, can you go over the charges one more time on each one of them since they're updated?
Sure. So the additional charges that were filed were for Ramon. Christopher was arrested on a capital murder charge. Ramon was arrested on a charge of abuse of a corpse. Yesterday, Christopher was also charged with abuse of a corpse, and he and Ramon were charged with altering, destroying, or concealing evidence.
As far as the capital murder charges, would it be 1, 2, or 3? Do you know about how many charges that Christopher would face? It involves all of that. Okay.
Yeah.
Of course.
Okay, and any further questions you have, you might want to just refer to the affidavit, arrest affidavit. Okay.
Claro que sí. Pues estamos aquí para hablar con respecto del caso que se trata de las víctimas, la señora Soto y el señor Guerra, Savanah Soto y Matthew Guerra. Quiero decir que le agradezco mucho a los miembros de la policía, del departamento de SAPD por el trabajo que han hecho, porque pudieron identificar sospechosos en este caso rápido, y es una cosa muy positiva para nosotros. Y hay un requisito que ellos tienen que presentarnos el expediente, ¿verdad? Los hechos del caso, para que nosotros podamos revisar esos detalles y luego hacer la decisión cómo vamos a cargar a estas personas formalmente con lo que se dice un indictment. Vamos a tener que esperar hasta que presenten todo. Más o menos tiene que se tiene que llevar de cabo
I
antes
wish
de
I
90 días.
understood. It's
Y
such a
después de ese
beautiful
tiempo
language.
vamos
I
a
wish I could
presentar
speak it and understand it,
los
but I
hechos del
don't.
caso ante un gran jurado.
I could listen to
Y
that all
si
day long.
podemos obtener el indictment o sea la acusación formal, entonces vamos a hacer decisiones de ahí en adelante, incluyendo la decisión si vamos a pedir la pena de muerte. Pero vamos a tener
I mean, I know
que
some
seguir
words,
con mucho cuidado, ¿verdad? Y vamos a
like mucho.
empezar con ese
I know.
paso y luego vamos a hacer las decisiones.
I mean, I hear some words and I'm like, oh, I know what that means. But, you know, being able to put it all together is a no for me.
Sure. Clearly, we have enough to charge Christopher with Preciado with capital murder because we have 2 adult victims. But under Texas law, when an unborn child, and it's under whatever period of gestation, is that unborn child is considered a person under Texas law for purposes of including an unborn child as an additional count for capital murder. We have every intention, of course, Chief McManus, actually, the sergeant made a comment that they intend to file 3 charges listing 3 victims. We have every intention of including the unborn child as an additional count for capital murder. But again, we'll have to wait and see when the case is filed. But that's correct. We can charge someone with additional count. While you're asking the question, let me clarify because it's already been asked. Why the father, Ramon Preciado, is not charged with capital murder. Someone can be charged with murder if that person is directly responsible because that person either intentionally or knowingly caused the death of the individual, or that person can be charged with as a party to a murder. But under Texas law, the only way that someone can be charged as a party is that that person has to aid, assist, encourage, or abet the commission of the offense intended. As far as we know, there is no evidence to indicate that the father was involved in the murder. Now, that may change as this case develops. The detective is going to continue his investigation. If there's at some point some evidence that the father was in fact involved in the murder, then that can change. But I know there is a common conception that when someone is an accessory, in fact, that we can charge him, but he has to be more than an accessory, in fact, under Texas law. We have to be able to prove that he was a party to the offense. So again, for now, the only one that's being charged with capital murder is Christopher Preciado.
Thank you all.
All right. So, Kel says, I heard the son confessed, then asked his dad to help afterwards. Yeah. He's saying, though, the son is saying, unless something has happened within the last day or so, that it was self-defense. I don't know. But whenever the police arrived at their home, when the dad opened the door, he said, I know why you're here. And, you know, they went ahead and they didn't have to drag it out of him, I don't guess, you know. But on a lighter note, I guess, I had this and I wanted to let me go find it because this is kind of funny, haha. If I can find it, where did I put it? Where did I put it at? I sent myself this link. And I'm sure most of you have seen it, but I wanted to share it just in case. For those of you that haven't seen this. Hold on just a second. Let me get it loaded up here for you guys. Hold on. Oop, oop. Can you guys hear that? Can you hear that? I don't know if you guys... I gotta start that over, you guys. It's funny, but not funny, okay? People were talking about this dude that jumped over... Hey, Morgana. This dude that jumped over the judge's bench and attacked this judge, okay? At first, I thought it was a male judge, and then I found out that it was a female judge, and then I felt bad because I was like, daggone, like, that's scary. And this dude can jump, right? Because you know how high those things are? I don't know how in the world. It was like the guy had a trampoline that he ran and jumped over on. You guys got to see this if you haven't seen it yet. But hold on, let me share this. Oh my God, it's so funny. It's funny, but not funny. Let me say that. Okay, and then I will start it over because I can't tell what you guys can see or cannot see. Let me move myself down like that. Okay, you guys, I can full screen it here. Start it over from the beginning, okay? Her name is Mary Kay something. I can't read the bottom. But you can see here is this woman, right? And you have this dude, like, young, fresh, pretty-faced clerk. I mean, I'm assuming he's like a clerk or something over here on the right-hand side. But, oh my God. Like, I just saw a clip of it. Well, this is like the full video, I think. You guys, okay, watch this. Now, it's loud, so, you know, be prepared to turn the volume down if you need to. Here we go. Watch this. I'll probably play it a couple of times.
Because I just can't with that history. In accordance with the laws of the state of Nevada, this court... Hey! Whoa, 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 hey! Whoa, whoa, hey!
Okay, now this guy right here, the salt and pepper dude with the blue suit jacket on, he's just kind of like standing there, right? Standing there with his arm up on the bench, like just watching. You're not gonna do it. And then the pretty little clerk boy. Okay, I'm sorry. That was very disrespectful. I don't know that the guy over here is a clerk. This kid, this guy, and I keep calling him a kid. This young man, okay, right here. And I don't know, he could be a lawyer, and he could be, I mean, he's a fully grown man, right? But in my mind, he's sitting there off to the side. I just feel like he's a clerk or something. But you see him here in a minute start punching. You see him wailing on this guy, right? He flew like Superman over that bench. I know. Kel says right before he jumped at her, he had the audacity to say he was an upstanding person. Yeah, he was standing up. That's about as upstanding as I could call it. But anyway, I got to start this over from the beginning, you guys. This is hilarious. Just watch the dude. and with the gray hair over here on the left, just stand there watching like he's, standing on the sidelines at a ball game or something.
Because I just can't with that history. In accordance with the laws of the state of Nevada, this court.
Hey! Whoa, whoa, whoa! Hey! Whoa! Hey! Oh, man, you're good, stop. Don't do this. Hey, where's Mary Kate? Is she okay?
Wow. You guys. Was that not insanity? Oh my God. Okay, that's the judge's clerk. Kel said he's down for protecting her, right? I mean, he was like, boom, 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 boom. It was like, oh. Not enough room. There were several people on top of the suspect. I know, right? He was going ham on that guy for sure. I know, it was all over the news. And I was just catching little peeps here and there. But, God almighty, that was like, that guy, her clerk, he was on it. He was not messing around. That was so... And I don't know where she was at. Was she still like right there under her chair? And they're over here piled up, on top of him, like a head-on collision. No, Tammy, the guy in the blue suit on the left-hand side of the bench at the beginning of the video, when it first happened, he had gray hair. He was just standing there. I'm assuming he was a lawyer, but he was just standing there like, Yeah, she was not coming up, right? Judge was knocked out. Yeah, she eventually stood up but looked out of it. I didn't catch the entire thing. They said that was the entirety of that, but apparently it wasn't, right? I bet she was out of it. I mean, good Lord. It was like, and flagpoles were flying all over the place. Sheesh. But I had to share that. I had to share that and laugh about it with you guys because it was pretty cray cray. The guy that was in the darker suit on the right hand side, Tammy with the dark hair, he was the one punching and punching and punching. That was the judge's clerk, apparently, yeah. She was knocked out. He slammed her head into the wall. Did she really get knocked out? Like legitly? God love, man. Crazy. Okay, now, let's get back to the Savanah and I saw that, but I didn't know if she legit was like knocked out, or if she was just kind of like hiding down there. Did they have to like help her? Did they have to like she go to the doctor? All alone. But on the Savanah and Matthew, back to that. Yeah, I'm gonna keep tabs on what's going on with it and see if they add more, what do you call it? More charges to those guys, and see what happens with that case. So, but capital murder, I mean, that means, yeah, they could either go for the death penalty or they could opt for not the death penalty and then just do life without parole. But, I don't know what'll happen with the dad. So, and then I'm anxious to hear more about whether it was the mom or the girlfriend, because like I was saying about the mom and the girlfriend, apparently Ramon's wife and him divorced, and he's got a girlfriend. And so I'm not saying that was who was in the truck. I don't know who was in the truck, but that was just an assumption, right? And don't know. I don't know. She was down and out, right? More disturbing than funny. It was very disturbing. It was very disturbing. I think the part that tickled me more than anything was the clerk, the guy in the suit, like wailing on him. But the fact that the guy was like, he was like a flying squirrel or something, I don't see how someone jumps that high, man. I don't know. But I want to keep tabs on Savanah and Matthew and baby. Is it Fabian? I think is what they were naming the little boy, the baby. It's super sad. Gypsy Rose. Next, I wanted to discuss a Gypsy Rose. Who in here has been keeping up with Gypsy Rose? I did not catch the Lifetime show. I wanted to watch it, but I haven't watched it yet. Apparently there's a new series, like the Confessions of Gypsy Rose or something like that. But if you haven't been hearing anything about Gypsy Rose lately, I don't know where you've been, because it's everywhere. Everywhere. And yeah, it's something else. I started watching, because what I had watched was apparently the series, and what I started watching last night was the documentary. What was it called? Mom and what was it called? Something, Mommy Dearest and Dead or something like that. I started watching that. That is really good. It's more of a documentary. It's got like her dad, her stepmom, her family, Dee Dee's family, like Dee Dee's nephew is in it. Really good. Yeah, Friday night, Tammy. Yeah, I didn't catch that Friday night. Did I say last night? I meant, but last night is when I watched the Mommy Dead and Dearest, I think. I found that on, and I watched it, but I haven't watched the Lifetime one yet. I'm excited for that, to see it. But she has been everywhere. Like, I think every major network has interviewed her. So those have been fun to watch. No, Tammy, Friday was the Lifetime show. The documentary I'm talking about is the one called Mommy Dead and Dearest that's been around for a couple of years, I think. And I don't remember where I found that at. I found it on Cinemax, maybe. Netflix, maybe. One of those. Yeah. It was really good. It was really good. I did fall asleep through part of it, so I have to go back and catch where I missed, but I'm anxious to watch the rest of it. But yeah, I just don't know how to feel about it. How do you guys feel about it? How do you guys feel that know about this? What happened and all that? How do you feel about it? I don't know how to feel. Part of me is oh, and wait a minute. I did hear that the Nick Godejohn, her ex-boyfriend that actually was the one that killed her mother, is oh, what was it? Let me see. Where did I put that up? I thought I saved it on my phone somewhere. That's not where it's at. Where did I put it? Well, I'm not sure where I put it at, but unless I emailed that to myself, maybe I did do that. He is apparently filing for another appeal, I think. So, I don't know what will happen with that. Tammy said, I think she should have gotten out. The boyfriend should get out also. Same prison time as she. Yeah. I don't know. I mean, there's so many people have so many different opinions on it. And I just feel like she was so young when it all happened. I know she was older, but in her mind, intellectually, she was stunted. And I don't know. But it's a very interesting case. I was watching her, what was it? I almost said Barbara Walters. I can't remember who it was that interviewed her on Good Morning America. Who was that? I didn't catch the whole thing. I just watched part of it. But that was pretty good. And, she was saying she, because I think a lot of people were ribbing her over all the social media posts and the selfies and all that. And she's like, I haven't had social media in forever. And now I get out, I'm just a normal girl that didn't get to do all those things that now gets to do all those things. I don't know. I think he deserves a retrial. I don't think he needs to be in General Pop due to him being on Spectrum. Same, I don't either. She was victim, but she wanted her mother dead. She was the planner and manipulated him. Yep, she did. I agree. I agree. But I don't know. I really want to do I'd have to put it together, and maybe that'll be something that I do this week where I can put together not a package, but sort of like a live stream dedicated to Gypsy, just to like Gypsy Rose, where we can watch all the things, but I don't want to do that without like having it all ready to go. You know what I mean? I just kind of, with that, I just wanted to just sort of like touch base and talk about it with you guys and kind of see what your thoughts were. And I know they asked her in one of the interviews if, because she's married, she's married now to this man, and Ryan something, and apparently they want to have kids, but they want to, like, they're not in a hurry. And she was asked if she was worried that she would be the same kind of mom to her children as her mom was to her, and she's like, no. She said, I learned to do the complete opposite of what my mom did. And I pray to God that's true. I pray to God for any potential children that she has that's true. That's true. That's true. So she got all the benefits. She knew it was wrong. She figured out how to get out of it. She could have just left. Well, but Tammy, that's the one thing she did. She did try to leave a couple of times, and it never it didn't work. Her mom caught her and made it so that, even the one doctor said that he knew that basically, in so many words, is that her mother has Munchausen's by proxy, and she has all of the advantages of all the different doctors and people on her side, and this and that and the other, that if he were to whistle blow to like social services, that they would never believe him. And she said the same thing, she's like, my mom, like my mom has everybody believing that I'm mentally disabled, and if I try to tell people that she's doing this to me, they're going to be like, oh, okay, sure, so anyway, and I think she was terrified. She was also terrified of her mother. So I'm not giving, that's not an excuse. I'm not saying, but I do feel like that she felt like that was her only way out. I do feel like she thought that. I just hate that it happened the way that it happened. And Dee Dee, the mother, like Gypsy wasn't the only person that the mother poisoned. She had tried poisoning her own mother, her stepmother. I think that her family actually blame her for the death of their mother, but anyway, that's all right, Lee. I'm going to be done here in just a few minutes. I'm going to go ahead and end it soon. We're caught up on the trial. We talked about Savanah and Matthew. We've hauled around, talked about Gypsy Rose for a little bit. Those were the things that I really wanted to do. It's Sunday afternoon here. It is 3:36 p.m. And kids start back to school tomorrow. Their winter break is over. So school starts back tomorrow, so I got to get him ready to go, and I got laundry to do, and a house to pick up, and things to do. So Gail said, just like domestic abuse cases, it's also a mental hold. Yeah. Well, and they said that after she had like ran away. She went to some kind of like Comic-Con or something. I don't know. And tried to run away with a friend of hers that was a guy and a boy. And her mom ended up finding her, and she made her leave. And when she got back home, she said she took I can't remember what she said, some kind of a hammer or something, and busted her laptop all to pieces and her cell phone all to pieces, and told her if she ever tried to do it again, she'd do that to her. And I don't know. But anyway, I would love to put together, one big live stream where we can go over and talk about all that kind of stuff from like start to end, jump around through the middle. And I think it'd be kind of cool. I know I keep saying that, and I really want to do that. It's just so weird over here on the True Crime Channel because there's so many different things going on all at the same time, all these different stories and cases and new things that are happening. And it's just like I want to talk about all of it, right? It's all just blah. So, but anyway, you guys, I'm going to go. I hope that you guys enjoy the rest of your Sunday. I hope you get to rest a little bit before the week starts fresh tomorrow. My plan is to be back here at 9 a.m. Eastern Standard so we can get started on this trial. And get back to it. So, but I hope that you guys would give this video a thumbs up. If you are new and you've stumbled upon this video and you want to hang around, I would love for you to subscribe and click the notification bell and make sure you check the all button. And come back and hang out with us some more. Thank you, Morgana. Thanks, Henny and Gail and Lee, Kel, Tammy. You guys are awesome. You guys are awesome sauce. All right. I will see you guys in the morning. Billy's like, I'll be snoozing. I'll be snoozing. I know you will, Billy. I know you will. We'll catch you whenever you get woke up and can come on in. Resting all day, Tammy says. All right. Well, you do that. Rest all day. Crazy busy week ahead. I love you guys. Talk to you later. Bye.